presentation is on depression. As you'll see in this image, 2 in 25 students currently have depression. However, only 1 out of 5 of them are seeking help for their depression. I chose to cover depression because not only does that reach adults, but predominantly adolescents as well. And this is a condition that's been rising since the 1980s. And I feel that it's very prevalent in the school system, so it's something that I wanted to touch on. There are 2 major categories of depression. The first is deemed major depressive disorder, and the second is called dysthymia. I just have some images here, what depression looks like. So just some, startling images and some words that we see displayed over here: hostility, suicide, anger, guilt, agitation, lack of energy, worries, excuses, irritability, eating disorders, overeating, hopelessness, low self-esteem, all of these issues. Okay, some statistics here that are not very positive. About 20% of all teens experience depression before they reach adulthood, so that's almost 1/5 of all teens are experiencing that before, the age of 18. Between 10 to 15% suffer from symptoms at any one time. So that means throughout the day, at least 10 to 15% of your students are depressed. Depressed teens usually have a smaller social circle. I found that one a little bit intriguing. Fewer career and educational opportunities, which makes sense. They are in a depressive state. And then they also struggle with relationships as well. So let's talk about who is at risk. So genetically predisposed, that means if you have a family history of depression, you are more likely to suffer from depression rather than someone who does not have that genetic predisposition. Females are more likely to be depressed as opposed to males. Abused and neglected teens, and then teens that experience trauma, and teens with substance abuse problems. So those are the specific population groups that you need to be on the lookout for. What are the warning signs? So some warning signs for depression include problems sleeping, low self-esteem, sadness, hopelessness, spending more time alone, physical ailments, lack of enjoyment in activities that they once enjoyed, meaning if someone was an avid horseback rider and now they are no longer interested in horseback riding at all. That's their, displaying a different characteristics in that manner. They possibly could be depressed. And then not caring about their physical appearance as well is also a warning sign. So how can you treat depression? Well, I have some important words over here that I found: help, support, advice, guidance, and assistance. So you can treat depression dependent on each individual case. So each individual case needs to be looked at. Treatment depends on the severity of the symptoms, but typically it's a combination of both psychotherapy, so therapy where you would go speak with a professional and receive guidance, and then medication can also be somewhat effective. So typically it's both, those two variables, both psychotherapy and oral medication that can be used in conjunction to treat this. Possibly, if the symptoms are extremely severe, it may require hospital or outpatient treatment program until the symptoms improve. And that is my presentation on depression. I hope that none of you have experienced this, and I hope that our students don't. However, the reality is, 2 in 5 students are suffering from depression, so I hope that this presentation was able to help aid you in, as you become a school counselor. Thank you for your time.